And very good morning to all, and thank you, Anika, for giving a very comprehensive overview of cluster endophthalmitis and the medical approach which we need to take in case such an unfortunate event occurs. So I'll be touching upon some of the standard protocols and the safe practices which need to be followed so as to avoid such an event. Uh, Now there has been growing evidence regarding sources of infection. There is published literature available, and one of these, a systematic review by Park et al. Recently was published in JCRS, and it did kind of, identify the cause of the organism, which was which was responsible for the cluster outbreak. And amongst those, intraocular solutions were one of the most common causes identified. And besides that, operating room environment, surgical instruments, and a couple of studies also reported contaminated topical anesthetic eye drops, IULs, and cotton wool swabs as well. So we'll just like to start with the OT complex layout. It is very important that our OT should be scientifically planned and adequate barriers exist between the sterile and the non-sterile areas. So clear out, barricades between outer zone, clean zone, aseptic zone, and disposal zone should be there. Ideally, OT should be in the upper floors and away from the IPD, OPD areas or any other area of potential source of infection. Of course, I mean, we might have a setup which is already there, but in case, this is just in case you have the opportunity to be planning a new OT. So it's good to sit with the architect also to plan it scientifically so that at least the airborne infection and the, because certain areas wherein uh, these staff can be kind of just roaming around, normal general public can walk into the OTs. There are various instances we've seen that such things can also lead to infections. And coming to the operating room, the OT as such, the OR should have an impervious, seamless walls with the floors should also not be made of certain tiles with a lot of grooves in there. And it's ideal to have vertical laminar flow and HEPA filters installed in the OT, which would help in improving and decreasing the airborne infection rate. And of course, all of us might not have a good setup, not good, I would say, a modular OT, or there are areas where sometimes when we work, we have a low resource setting there. So in that case, at least safe practices and building a culture of safe practices amongst the staff goes a long way in preventing such outbreaks. So in the OT, for the OT as such, keep the OT doors closed, restrict the number of personnel in the OT, and especially people with active infection should not be allowed in. Then fumigation and surface infection is absolutely important to kind of ensure that the airborne infection is minimized, and standardized solutions which are available should be used for this. Bacillocid special is one of the common ones being used, which is glutaraldehyde based, and then there are some others like bacillol, which is ethanol based, and hydroxyl peroxide as well. As for the surgical instruments, a rigorous sterilization protocol has to be in place for sterilizing instruments, because that is also one of the major causes leading to an outbreak. So autoclaving, as we all know, is the gold standard, and of course ETO for certain instruments. And in a high volume setup, it's mandatory to have a new instrument, not new, I would say you should have several instrument sets so that they can be autoclaved in between cases. So have so many so that you don't have to use instrument sets by just dipping in some solution or something like that. So, and besides the autoclaving process or the sterilization process, it is also mandatory to monitor the sterilization with chemical and biological indicators, and record keeping is utmost. Patient hygiene, that is yet another factor which can lead to uh, to infections at times. So it is important to educate our patients also regarding hygiene, and patients should be kind of, should change and wear disposable shoes, covers, so that before they enter the OT, they are not bringing in the infection inside. And then again, besides patient, the staff uh, protocols for staff is also absolutely essential to ensure a safe environment for surgery. Coming to scrubbing, uh, well, it's ideal to have a steel prefabricated scrubbing area with all the important information also displayed, and should have a clock as well with a minute handle. And as for the scrubbing technique, that is again very important. So retraining of staff needs to be done so as to ensure that the scrubbing technique is appropriate. Hands should not be kind of, dangling down while you are scrubbing. Things like wearing all these rings or some bands, even if they are religious, they won't protect you from infection. So they need to be out before you go in for scrubbing. So again, staff training, retraining is important for that. Drapes and packs do create a barrier between the environment and the surgical field. So it's very important to take due precautions while you are gowning. Your mask, your mask should be covering the nose importantly. And in case you don't have you don't have access to disposable gowns, or they are turning out to be too expensive, wear a plastic apron beneath the gown, the sterile gown, the cloth gown, which are made in-house. And then regarding the opening sterile packs, that's the technique of doing that is also very important. Some of these things are very basic, and we assume that the person who's kind of assisting us would know, but like I said, training, retraining is very important to ensure that all the staff members do kind of practice, take care of these techniques, and have a safe practice there. Okay, so WHO had come up with a surgical safety checklist for all types of surgeries, general surgeries. So these can be adapted. So AAO has adapted for eye surgery as well. So surgical safety checklist kind of just ensures that all concerns regarding patient safety are in place before before giving anesthesia. For us, of course, topical is the most commonly used, and then before the incision and before leaving the operating room as well. Intraocular solutions, as we know, have been the main culprit for causing infections and especially outbreaks. So it is very important that we take care of and look into details of all the solutions which are being used. So the batches should be kind of looked into, and a record of that is important. Coming to the irrigating fluid, which is one of the most common causes again. So it's good to use a flexible pouch or glass bottles, and before you start the surgery, the staff should be trained to physically inspect the fluid bottle against light, and bottles should be preserved for say 24 hours odd, and batch numbers of all the consumables should be very meticulously recorded. Documentation, importance of this cannot be overemphasized. It starts with the consent form also. So patients should be aware of the surgery, the associated risks. It should be in local language and signed. And you could create a checklist, patient safety checklist in your own institution, which kind of one sheet which documents all the pre-op features, the risk factors which could be there. Say patient is on antiplatelet drugs, things like that. And record keeping, like I said, is absolutely essential.